Welcome. I'm Dr. Brian Bushik, Amplifier's General Manager for Healthcare and the company's Chief Healthcare Innovation Officer. Most of my time is focused on Amplifier's Healthcare Alliance. That's a growing ecosystem of health systems and other notable partners, such as Health Catalyst, that are collaborating to improve quality, patient safety, and provider wellness, while tackling challenges that include sepsis, CLABSI, EHR training, and many, many others. With me today is Dr. Brent James. I suspect that many of you are already quite familiar with Brent. Dr. James is currently clinical professor within the Clinical Excellence Research Center, also known as CERC, at Stanford University Medical School. He's also a visiting lecturer at the T.H. Chan Harvard School of Public Health and an adjunct professor at the University of Utah in both the School of Business as well as the School of Medicine. He's a member of the National Academy of Medicine, formerly the Institute of Medicine, and helped produce many of the IOM's groundbreaking reports on quality and patient safety, including To Err is Human and Crossing the Quality Chasm. Dr. James is a fellow of the American College of Physician Executives and is presently a senior advisor at Health Catalyst, senior fellow at IHI, senior advisor with the Levitt Group, and I'm happy to say, chairman of Amplifier's Clinical Innovation Advisory Board. As important context for today's conversation, Brent was formerly Chief Quality Officer and Executive Director at the Institute for Healthcare Delivery Research at Intermountain Healthcare, based in Salt Lake City. Thanks for joining us, Brent.
Great to be with you, Brian.
A good starting point might be what you see as the biggest challenge that healthcare professionals are currently experiencing.
I believe the biggest single challenge that clinicians face today is complexity. That often takes the form of information overload. We expect health professionals to take the massive amounts of information stored in their heads and somehow correctly deliver it to individual patients. Stanford's Dr. David Eddy said it well. The complexity of modern medicine exceeds the capacity of the unaided expert mind. When you combine highly trained professionals with more effective systems to generate, deploy, and manage knowledge, it is possible to move care delivery systems far beyond what any of us now believe is possible. I was first introduced to Amplifier while at Intermountain. What I saw was a tool that much more accurately, completely, and rapidly loads complex clinical knowledge into expert minds. It gives us not just the ability to transmit the knowledge, but the ability to measure how well we transmitted it and how well it stuck, and to identify specific areas where things are falling short.
Why was it that CLABSI was prioritized for improvement at Intermountain?
It all started back in 2017. At the time, Intermountain was experiencing 1.09 CLABSI incidents per 1,000 line days. Just in passing, that was already well below the national average. Our further success, though, started with a study we conducted in 2013. It laid out an evidence-based standardized approach to disinfect needleless connectors in CLABSI setups. We learned from hard experience that nurses often struggle to comply with this recommendation. That often left patients vulnerable to central line infections. One very big challenge to dropping CLABSI rates was finding ways not only to educate our nursing staff at scale, but also to actually change behavior.
Brent, can you say a little bit about the technology selection process as you were evaluating e-learning platforms?
Kind of a funny story. It all started with a visit from Amplifier's Bob Bergen. As was often the case, I got tagged to listen for an hour to the next great innovation that some entrepreneur thought would massively change medicine. This turned out to be one of the very few times when that activity actually bore fruit. Bob talked about a new approach, operating through a computerized training platform that could acquire data on what nurses know and don't know as it trained. And it actually made sense. It looked like it could work. After that meeting, I told Kim Henriksen, Intermountain's Chief Nursing Officer, about it. I suggested that it was worth following up. Kim assigned it to Tammy Richards, one of her most capable Assistant Chief Nursing Officers. Tammy and her team turned the Intermountain protocols for managing central venous catheters into Amplifier training modules. That made it possible for our nursing leadership to find and fix CHM, confidently held misinformation.
CHM, or confidently held misinformation, that's when you're sure you're right, but you're actually wrong. I can definitely relate to that circumstance. CHM exists in all individuals, but in healthcare, it can have dire consequences.
Right. It creates misjudgments that can, and very often do, result in patient harm.
What criteria were important as you further considered the role that an adaptive learning platform might play in this new intervention?
Well, that first meeting, Bob showed me how the Amplifier platform was built around the very latest cognitive science research coming out of Harvard University. He described principles that are proven to promote rapid learning and long-term retention.
Brent, was the adaptive nature of the platform an important factor in the selection?
Compared to what I'd seen before, there was really no other game in town that even came close to functioning at this level. We'd never seen anything quite like it, and it had a lot of advantages. For example, personalized learning can shorten training time, as we later demonstrated, by focusing on material that the clinician doesn't already know. That's sometimes called competency-based training. The Amplifier platform engages learners by asking questions to assess their current knowledge level. Then it targets training content to legitimate need. It also asks learners to state their confidence level as they select answers. That pinpoints confidently held misinformation. The platform then customizes the course in real time to fill and correct critical knowledge gaps.
Right. In doing so, learners don't have to waste their time studying or repeating material that they've already mastered. Could you say a bit more about the course itself? How was it developed at Intermountain?
Well, it started with a group of subject matter experts based at Intermountain. They teamed with Amplifier's support group, truly expert at developing these kind of computerized learning tools. They worked together to develop what we called the Central Line Associated Bloodstream Infection Prevention course. The course consisted of 27 questions across 12 CLABSI topics based on the latest evidence and best practices. Of course, we built it on the foundation of CDC guidelines. It was designed specifically, though, to eliminate confidently held misinformation and uncertainty and other knowledge gaps that could lead to avoidable infection. The 12 main topics included antimicrobials, bacteria, duration of catheterization, appropriate equipment use, inappropriate use in general, incontinence, line maintenance, pressure injuries, infection prevention, risk factors, timely removal of the catheter, and urine cultures. You get the idea. It's quite a list, but we were able to put that entire content into a terse, well-focused, complete training module.
And then once the content was organized and available, how was the course deployed?
Well, Intermountain had something called a learning management system. Most care systems do. We deployed it on the Amplifier platform linked to the Intermountain Learning Management System. It initially rolled out to over 3,700 nurses from early September through mid-October in 2017 across 25 Intermountain locations. It worked through an email link. We sent that out to the nurses. It went to a mix of RNs, charge nurses, LPNs, nurse practitioners, RN educators, and others.
How about the results, Brent? What did you and the team there find?
The platform itself tracked every learner interaction. Its reporting suite visually depicted CHM, confidently held misinformation, uncertainty, and then areas of true mastery. Here are the resulting heat maps showing CHM struggle and remediation. The reporting system can aggregate the data to show different attributes such as location, role, department, working shift, and topic. In this heat map, the data were filtered by topic and role for all of Intermountain's 25 locations. We then drilled into the data and identified 6 topics that showed significant CHM. Number 1, blood draws from central lines. 2, CLABSI incidents and catheter type. 3, CLABSI prevention and antimicrobial stewardship. 4, routes of infection. 5, catheter selection site. 6, catheter and or administration set replacement.
And what about the outcomes, Brent? What outcomes were measured and what was the overall impact on incidence and economics?
First, Brian, we had probably the most complete set of training metrics I've ever seen in terms of understanding how the training was deploying and how well it was working. But of course, as an intermediate, you have to carry it down through the final outcomes, and that's an infection. Clinicians base their actions on decisions, and those decisions rest on a sense of professional confidence. As we eliminated confidently held misinformation, Tammy and her team were able to greatly reduce mistakes made with confidence. To just give you the final result, following deployment of the CLABSI prevention course, initially, CLABSI rates fell by an average of 49%. That was across the following 7 months compared to the previous 12 months. Across the next 26 months, though, more than 2 years, Intermountain's CLABSI rates were down by 28%. That meant 35 fewer CLABSI incidents per year. Now, Intermountain runs a true activity-based costing system, and we knew that a CLABSI added about $48,000 per event to the cost of care. That means that 35 fewer events turned into a little bit more than $1.6 million of real annual bottom line savings, and that's from CLABSI alone. Just to be completely clear, I really do love to tell this story, but I was only the matchmaker. Tammy and her colleagues did all the heavy lifting, both for development and deployment. That's where the real credit lies. And it didn't end there. Tammy went on to develop similar amplifier-based training for catheter-associated urinary tract infections, CAUTI, and achieve similarly spectacular results.
Thanks so much, Brent, for recapping Intermountain's experience using Amplifier to better address CLABSI and other critical challenges such as CAUTI. We can remain very grateful to you, Tammy Richards, and the entire Intermountain team for developing the CLABSI course, the CAUTI course, and making those both available to other health systems throughout the country. Thanks much.
Thank you, Brian. It's a delight.